www.healthcmi.com. Acupuncture continuing education online. Today, acupuncture helps patients after a stroke. This article was published on January 6, 2019 at healthcmi.com. Simply click on news and look for the article entitled Acupuncture Aids Swallowing After a Stroke. So many people are aware that acupuncture can help people with limb movement after a stroke, getting the arms and legs to move again and being able to walk or grasp things, lift things, use a pen, things like this. What they don't always know is that acupuncture can help with swallowing. This is a big problem after a stroke. For a lot of people right after a stroke, they can't swallow very easily and a lot of it returns right away. For others, it doesn't return as well. So there can be a lot of issues with eating, drinking, even speaking. So this is very important. So this will help with difficulty swallowing or chewing. There can be issues with coughing or choking, especially when drinking water, and dyskinesia of the soft palate, throat, tongue, or facial muscles. So what we find in this research is that when acupuncture is added into a standard protocol, a standard recovery protocol, that the effective rate is much higher. And people after a stroke need as much help as they can get. So in other words, if people had standard rehabilitation therapy, they had an 89.8% positive outcome. And that positive outcome includes everyone who gets a little bit of result to great results, right? So just a total effective rate. But that total effective rate jumps about 8%, all the way up to 97.96% if you add acupuncture into the treatment protocol. So what's great about this is that once you add acupuncture into this post-stroke protocol, people have a much better recovery. So a higher incidence of getting the ability to swallow comes back, but also better quality of swallowing as well. This is very important. So the acupuncture points used were Feng Chi, Wang Gu, Yi Feng, Feng Fu, Ya Men, and Liang Chuan. So that's gallbladder 20, GB 12, triple burner 17, governing vessel 16 and 15, and CV 23. So a great piece of research and something that can never really be overlooked, because this is an instance where people need the care the most. And I think something else needs to be mentioned here, that the results an acupuncturist gets after a stroke are better if we can get to the patient as soon as possible. So there's a 1 week window where somewhat miraculous results can take place, especially when using scalp acupuncture. Then there's a 2 week window and a 3 week window. And in that period of time, we can make tremendous gains very quickly sometimes. After that, it can be very difficult to make changes, and it's much more incremental. So speed of access to the patient to get this care in is very important. It's not to just let them linger in a hospital and recover without getting actively involved. The sooner they can do physical rehabilitation exercises, the sooner they can get acupuncture, the better. So we want them to be up and around and moving as soon as possible. So I'm hoping you like this information. It's something that's vitally important to patients, especially in this time of need after a stroke. Thank you for listening. I'm Adam White, licensed acupuncturist. If you like our podcast, go ahead and leave a review. www.healthcmi.com.